If Texas Advocacy Project were to receive this grant from Impact Austin, we would be able to make some long, sustainable changes within our organization by bringing in a social work department. And we know that coupling social work with legal services will get a survivor safe long-term, both physically, mentally, and emotionally. Texas Advocacy Project has brought in a social worker to help lay the foundation of this program, to help guide how we will provide services and how we will couple with our legal department in order to make sure that survivors, when they're in their highest time of crisis, are able to get the long-term solutions that they need. It's very important to us at Texas Advocacy Project that we are wrapping survivors in full services. While we know that if you have a protective order, you're 80% less likely to get re-victimized, we also know that when you have such serious trauma, moving on to the next step and getting to those orders is very difficult unless you have an advocate like a social worker working alongside you to help you to be able to process everything that is happening to you, for you, and with you. Texas Advocacy Project has been providing free civil legal remedies for 40 years now, and we know that what we do gets people safe in the long term. But what we've also learned is that mental health issues are so dire right now, especially after the pandemic. And we also know that people really need extra support in order to get through our systems in a more timely manner so that they can get to that next stage in their life faster, so that they can be there for their families, so that they can start their new lives. We know that bringing on a social worker is going to help people to access resources better, to understand the process that they're going through, to heal quicker. And isn't that what we want? We want people to be safe, to heal quicker, and to be there for the rest of their families and for what's going to come next in their lives, to be prepared for it. Unfortunately, at Texas Advocacy Project, since the pandemic has occurred, we have noticed so many more high-risk cases coming in. These women and these children that really may not survive if we don't get them out fast, if we're not able to provide them with services. We have people that have been physically, emotionally harmed, and we need to help them. We need to wrap them in services. We have a track record of being able to do this, and we just need to do it better, longer, and we need it to be sustainable. So an investment in Texas Advocacy Project right now is really going to be pivotal for how we're going to serve people in the future. And I know from my heart that this will save many, many lives sooner rather than later.